those helping Ukrainians still in the country is Cheshire nurse Lorraine Lloyd. She's actually an A&E nurse at the Countess of Chester normally. She spoke to us on breakfast a few weeks ago when she'd been to Malawi with frontline medical aid charity UKMed. Now part of a team who've set up a mobile health clinic about an hour south of Lviv in the west of the country. She's been telling me about her involvement with UKMed.
No, well, I've been a member of UKMed for a couple of years now, just to assist with humanitarian needs, which has been fabulous. So obviously I was in Malawi in December, and now this is my on-call period, so I have been delighted to be called and come to Ukraine to help the team here.
Is this something that you volunteer for, in effect, then, to go and be part of UKMed?
Yes, they like senior nurses, clinicians, to use their expertise to obviously bring it to sort of sometimes low resource areas that need extra support, education, clinical support. And obviously this is a very unprecedented situation, so this is why we are here offering our support and clinical care for people here.
And with you saying that you're in Malawi recently, did you expect to be in another country so soon?
No, no, not so soon. But it's fine. This is my on-call period with UKMed. We have certain periods during the year where we are on-call, so I'm more than happy to be called upon again.
How did it feel when you got the call?
Well, some trepidation. Obviously, there's been an awful lot of media coverage on this. It's been horrendous listening to the news. And yeah, some trepidation, but yes, more than happy to come and help here.
Yeah, and I'm guessing as well that your family, perhaps have a little mixed feelings about you doing it. What did they say to you?
No, they were very supportive. They have been very supportive. Obviously, my mother was a little sort of upset, but that's understandable. But no, on the whole, they've been extremely supportive and rather proud, so they've said, of me being here.
I bet, yeah. And you've got more than 40 years nursing experience behind you. I guess, do you have to call on all of that experience doing what you're doing out there at the moment? Yes, some of it, yes, we do. And that goes from working at home as well, as well as being here. But we've got a really good team here, lots and lots of highly trained and highly experienced doctors and nurses here. What is the situation like out there?
The situation, I mean, it is sort of life as normal here. They are carrying along. We are getting updates on bits and pieces, but we're in a very a relatively safe area. But obviously, it's very fluid and changing, so we're just being updated on those things. And obviously, our business here is to sort of provide care in a static clinic and a remote clinic where we are going out to look after people that have been obviously had to flee their homes and provide them with primary healthcare needs. Do you have a typical day, or is every day different? No, every day is different. We do have a clinic here where people can come and access medical care here, and we have a remote clinic. So we go out because obviously there's about 15,000 displaced people here. They're all being accommodated in a variety of large sorts of buildings, from schools to university campuses. They've all been accessed, and obviously the people that have had to flee are being housed in some private homes, but mostly in a lot of these large facilities. So we're going out during the day, morning and afternoon, to do clinics, designated clinics to serve those clinical needs.
I guess if people are in large groups, there's more chance of spreading infection and things like that, is there?
There is, unfortunately, yes. So this is why we're trying to just provide sort of some education and some just look after the healthcare needs that they have at this time.
How different is it from your job at the Countess?
Not much different. Patients are the same wherever you are in the world. They come to us and they're unwell. We have a fabulous team of interpreters that really do help us greatly. Yeah, and we're seeing sort of similar conditions to what we would see at home. sort of people with asthma, high blood pressure, chest infections, urine infections. We see lots and lots of children, usually women and children and elderly, and all the ramifications of the illnesses that come with that as they've had to leave. We are seeing an awful lot of psychological trauma, obviously, because people have had to flee, and the trauma of that situation through the conflicts. We are seeing an awful lot of that, and we're working towards, with partners, providing, pointing them in the right direction to get that help, because this is going to be a long-term thing for a lot of these families.
Is it hard not to get emotional when you're doing the job, or I suppose your training kicks in to a certain extent, does it?
No, there's still human factors involved here, listening to these people's stories. People that have had to actually leave their homes because they've been explosions, they have no home to go back to. They're spending sort of a week with no food, no water. They're having to, one lady was telling us she had to eat snow for her and her family before they managed to get here to get some assistance in one of the accommodation blocks here. So yeah, it is very sad. And it's very traumatising for them.
Yeah. Last time you were on the show, I think you talked about how your trip to Malawi gave you a new perspective on your job. Because let's be honest, It's not exactly been easy in the NHS. It's been a very stressful couple of years. What's it like to step away from that into a different type of stressful situation?
It is. I mean, it's similar. I mean, people have stressful situations. This is very unprecedented. This is a conflict area. And people are coming back with stories that we don't often hear in the UK. Of having lost their homes, having lost family members, having left family members behind, and just having to run with what they have to get to a place of safety. So it's very, very sort of traumatic to listen to those stories. But the most that we can do, we will sit and listen to what they have to say, offer some empathy in the situations they're in, but primarily, and try and help them out with any health needs that they have, and point them in the right direction for some, obviously, long-term assistance.
Well, all the very best to you, Lorraine. Thank you for talking to me. Stay safe out there.
Oh, you're more than welcome.
All the very best. That's Lorraine Lloyd there, Cheshire nurse, normally at the Countess, but at the moment over in Ukraine on the border there, helping UKMed, the charity.